Before we get started, please make sure to mute your phone lines until the end of the briefing when we will take questions. Good afternoon. I'm Tom Nowicki, an emergency doctor at Hartford Healthcare. Thank you for joining us today. Here is an update of what's been happening at Hartford Healthcare at this time. We are working to ensure that we continue our ability to test our state's most vulnerable patients. There are strict guidelines to help make this happen. We are prioritizing testing for the most vulnerable, those individuals who exhibit symptoms or have been at high risk of exposure. Remember, if you have minor symptoms and you're otherwise okay, just stay home. Self-quarantine. The state of Connecticut recently ordered additional testing kits and personal protective equipment from the Strategic National Stockpile. We are working closely with the state and our colleagues at other healthcare organizations. Reminders: if you have an upcoming appointment at any doctor's office or clinic, please follow these new safety measures. If you're experiencing any of the following symptoms, please do not visit the office in person. If you have fever, cough, runny nose, chills, sore throat, or body aches. If you have any of those symptoms, call your provider before going to the office, even if you have a scheduled appointment. The medical team there will discuss your symptoms and provide instructions for the most appropriate next steps. We appreciate your understanding and cooperation as we work together during this difficult time. We want to make sure that you continue to get the care you need safely and conveniently. We've increased the number of drive-up testing locations across Connecticut and telehealth capabilities, but referrals from healthcare providers are required. Call your Hartford Healthcare medical group provider for a referral. If you do not have a medical group provider, call the COVID-19 hotline for a telehealth visit by calling 860-972-8100. There is a strict protocol when it comes to testing for COVID-19. Testing can be ordered by primary care, pulmonary medicine, critical care, infectious disease hospitalists, and emergency medicine physicians. We have also heightened visitor restrictions, so be sure to check the website before going anywhere. And now, I'd like to introduce Laurie St. John.
Hello, I'm Laurie St. John, Vice President of Hartford Healthcare at Home. We have all heard the most vulnerable population during this COVID-19 crisis are people over 60 years old, our seniors. For this population, our advice for safety is the same. The first line of defense is hand washing for 20 seconds. Keep practicing social distancing from people. We are limiting our home visits and screening workers and patients. Our staff is wearing the proper equipment when visiting clients: masks, gowns, gloves, eye protection for people who are suspected or who are confirmed for COVID-19. 80% of the people who contract COVID-19 will have mild to flu-like symptoms. 16% will have more serious issues that could actually result in death. We are taking every precaution to protect our patients. We have decreased the amount of exposure they have with us, Hartford Healthcare at Home, by contacting our clients by phone and cutting down on the amount of home visits. Our instruction to our older population is to restrict visitors and make sure they and their family practice good hygiene and the safe practices I mentioned earlier. We are currently exploring the expansion of telehealth services. I would like to now introduce Dr. Sharon Kiely.
Thanks, Laurie. Thank you for the opportunity to speak with you today. My name is Dr. Sharon Kiely, and I'm the Vice President, Chief Wellness Officer, and Associate Chief Medical Officer for Hartford Healthcare. I was trained as a primary care doctor. Hartford Healthcare is committed to the safety and the health of the communities we serve and to our 30,000 clinicians and staff. At this time, many of our colleagues have been asked to work from home, and they stand in support of those on the front lines in our hospitals, urgent care centers, skilled nursing facilities, and in home care. We share their priority to provide safe care safely. As recommendations and new information becomes available, we are working to assure that the information is assessed and shared. Right now, groups of clinicians and staff are working to make sure our clinical processes, policies, education is focused on that goal, safety. In addition, we are leveraging the incredible resources at Hartford Healthcare to support the clinicians and the staff during this unprecedented time. The Wellness Department is working with every department in the organization to identify and implement ways to support all of our colleagues. This is a really uncertain time, but we know that in uncertain times, communication, clarity, and innovative thinking can solve problems. Differently would make a big difference. We now will open the line, for questions. Do we have any questions?
I have a question. In terms of hospital beds,
with Fox 61 News. Do you have a question now? Can you hear me?
We can hear you.
Oh yeah, Brian Billick with Fox 61 News. When it comes to your drive-through testing at this time, when it comes to that drive-through testing, where are we at right now as far as terms of numbers?
We now have, I believe, 4 open sites through Hartford Healthcare that are functioning for drive-through testing. The numbers have been variable. On the first day, I believe we had approximately 25 at our first site at Hartford Hospital, and those volumes have grown to as much as over 200 per day, is my understanding.
and where do you guys stand currently in terms of having enough hospital beds? How confident are you, or how worried are you, or how quickly will hospital beds become a concern?
It's very hard to predict. However, I will say that I am very comfortable and impressed with the response from our healthcare team all throughout the system and really throughout the state. Everybody is taking this extremely seriously and putting operations into place to be able to care for all of those patients. We're making sure that we have the right equipment and space to be able to provide that care.
Excuse me, how concerned are you about shortages in protective supplies, swabs, and other equipment?
We do have a level of concern, and we're taking measures to try to make sure that we have enough supply of all of the protective equipment, testing supplies, and care equipment that we would need for patients. I think we're at this time in reasonably good shape, but without knowing the future, we're concerned and working to be able to make sure that we have adequate supplies.
Is there any type of equipment in particular that you're concerned about running out of at some point?
Nothing that I can say specifically. I think, again, we've been as proactive as you possibly could be to make sure that we have those supplies. But looking at other countries, it's hard to predict how quickly this is going to hit. Again, social distancing is a huge factor for us to try to level that curve.
Thank you.
You're welcome. Any other questions? Thank you.